A culture of fear where bullying and intimidation were rife, all for doing the right thing, exposing mistakes or wrongdoing in the NHS. Whistleblowers say the report doesn't go far enough, although the Health Secretary, Jeremy Hunt, promised to fast-track legislation to make sure that staff do feel safe to speak out. Not that it will help those who've already lost their jobs, their families and their normal lives, as our health and social care correspondent Victoria MacDonald now reports.
There is a familiar theme that runs through the stories that NHS whistleblowers tell.
Children were dying or being harmed.
At least 171 children died who would have survived in other units.
I was marched off premises. I managed 60 staff in the department, and nobody could understand what was going on. It was really humiliating.
And there are many, many more of these stories. But today it was acknowledged in a report to the government that the way some whistleblowers have been treated is truly shocking. This report was commissioned after 6 whistleblowers came for a meeting here with the Health Secretary. And in all cases, they told a similar story of victimisation, of bullying, of facing financial hardship. 5 of them actually lost their jobs. But mostly what they all described was the complete and utter despair they felt at not being listened to when they were trying to raise safety problems in the NHS. The review's author, Sir Robert Francis QC, said NHS culture now needs to change. What was it that shocked you?
Well, I think back to actually the mid-Staffordshire experience I had of listening to patients and their families and the impact listening to the suffering they'd gone through when their complaints weren't listened to. And actually what staff go through when they raise honest concerns and are not listened to is exactly the same.
Yet the whistleblowers themselves have today criticised the review for not dealing with past or even current cases.
Unless people that have lost their jobs who are currently suffering with disciplinary action or in the court system, unless their stories are heard, unless they are acknowledged as whistleblowers and unless some practical form of redress is found for those people, I think we are going to be, have continuing difficulties with being able to feel confident about our health service.
The review also expressed concerns at the way black and ethnic minority staff are treated when they blow the whistle. It said there is a perception they are more likely to be referred to professional regulators if they raise concerns, sanctions are harsher, and that they experience disproportionate detriment when they speak up. In other words, that they are treated worse. The report's recommendations, including new speak-up guardians in every hospital, were accepted by the Health Secretary today, as was a call for anti-discrimination laws for whistleblowers looking for new jobs.